Hey, we're here for part two of Miss Amanda's first month of block therapy update. Are you
Hello.
ready for the next set of pictures?
Glad to be back. Excited. Yes.
These are these are really good. I really am so happy for your progress. Let me see if I can get more of your pictures ready. Okay. The side view. I'm so excited for the side view.
Me too. Me too. Okay. Do you want me to say what I notice off
Yes.
the bat?
Tell us what you see.
Okay. Well, first of all, I'm not leaning as much. My head is like to the door. That shoulder is up closer to my ear. And my the grips on my legs. I like how you call them grips or adhesions on
Mhm.
that outer thigh. I really notice. And the also the pelvis. So the belly shape has changed a little bit. Or maybe it's a little bit smaller, but I think that's also because I don't have as much of that anterior pelvic tilt leaning forward. It's coming back into alignment. And again, not as squished and as much pressure in the back. um, those are the takeaways that I see immediately.
You're going to be a fascia expert before you know it.
That's the goal.
That's the goal. Yeah, I want to just talk about the space between your ear and your shoulder. It just, if you think about your body structure, like if you purposefully pushed your shoulders up and held them there, think about how much pain and tension you would have by the end of the day.
I did.
And and you did.
I
You
did. I always had pain and tension there. And I would always catch myself. Once I started having more bodily awareness, I was like, oh, I'm like, why am I doing this with my shoulders? Why am I clenching my butt when I'm standing here? Like part of that's that nervous system and fight or flight. And I know this works on the nervous system as well.
Mhm.
And it can be extremely relaxing. I've fallen asleep on the blocks before. But yeah, that just that nervous system and just all that tension and tension and clenching that I was doing before. Yep.
Yeah. And once you release that shoulder, there's so much more space for your neck and your shoulder to move. But also look how much more relaxed your arm is hanging.
Yep.
It almost looks like you're on purpose, like holding your arm up a little bit. And
It
I know
does.
you weren't. That's just how much tension was all through that upper arm.
Yep.
You're in this after picture, it actually looks like your shoulder to elbow is longer than in the first picture. And we
Hmm.
know that your bone didn't grow. So it's just so tight and gripped and compacted. And here you can see a little adhesion here, but I think it's because there's so much inflammation and here it has let go that you can now see a few extra things that you couldn't see before. But it also, if you look
Right.
on your elbow, there's this right here was very obvious. There's a dent right there. That's what I've heard lipedema women say. They have this groove or this dent. And in this picture, you can see how much softer those lines are right there. And that's just proof that we can see that all those adhesions are letting go of that tight grip that they have on your arm right there. That's going to bring
Yeah.
a lot of circulation back. I know for me, like the backs of my arms used to be really cold to the touch. And now I have circulation again and they're normal skin temperature. So all of those things make me so excited when I see them because I know change is happening under the surface that's going to affect how your arm functions, the nutrients and lymph flow that can get through that arm that used to be so compacted. It's going to make your arms feel so much better.
All these non-scale victories, and it's like the elbows are a big problem for me. I mean, and wrists too, and just hands. Like I suffer with carpal tunnel, cubital tunnel. I do office work, but I've just for decades, probably a couple decades now, I've had issues with my arms. And so yeah, to see that elbow grip just release, and it's like ask me how many times I did the block there. Zero.
Zero.
I never put the block there, not even close. So that's the other thing that's just crazy. I'm like, how am I getting results in these areas where the block never even touched? And like the grips on my thighs, I never put the
Yeah.
block there. I had the block closer to my knee, like for my IT band,
Yeah.
twice at
Here.
most in
Yeah.
that month. Yeah, twice at most. And so to see the improvements that just come from releasing other areas is amazing. And again, you can see it in the feet too, just
Yeah.
less inflammation there, like at the front of the ankle. But I'll let you point out any other things you see besides the obvious new bruise, that I have.
Well, we always,
Unexplained lipedema bruises.
yeah, that's a whole other thing. Although I will say, um, I don't hear much that people bruise from the block. That's a question that comes up. But the surface is wide. It doesn't dig into a point.
Right.
And so I don't hear much about, I mean, I don't know that I ever have, but bruising is not really one of our concerns with this. So that's a positive.
Yeah, that's from something else. I haven't bruised from where I've had the block.
Yeah.
Even though like it will be painful when you're initially putting pressure on it. And
Mhm.
like maybe we can talk about that in part 3. Like it's amazing how quickly that pain starts to dissipate and you're like, okay, and you're able to relax more. So
I want to talk a little bit about your hip tilt, but we're going to start in your
mhm.
feet
Okay.
because this foot over here has much less inflammation. Here, it almost looks like you have a little hill
Yep.
going on the top of your foot. Your ankle congestion and inflammation is much less, but also this is what causes your hip to tilt is the way this bone, the tibia, sits in your ankle joint. So here you can see the tibia is going this way. Here you can see that the tibia is more in line. And I'm not saying you can see the bone, but you can see from the alignment of your calf, you can see, if you look, you can
Yeah, it's
see
not as curved. I
it's
mean,
not as,
inward like this.
and the back from your knee to your ankle on the back side it's very curved. That's because it's hyperextended. And you still have some of that to a degree, but you can see that it's a gentler curve. And so
Right.
when your tibia attaches here to your kneecap, it pulls your kneecap this way. And then when your kneecap is attaching back here, your femur, which is it should all be a straight line from ankle to hip joint. But then your femur has to tilt forward because it's attached back here instead of where it needs to be. And so this curve that a lot of women have on their thigh is actually because the femur is having to tilt forward.
Interesting. It makes sense.
And when the femur's over here, this hip joint they're reaching for each other. They can't, like you can't take your body apart and put it back together. Everything just has to bend and move to where it stays attached. Your femur needs to stay in the hip socket. So if your femur is like this, your hip socket's having to tilt to get to it. And here you have the beginnings of your hip, your anterior pelvic tilt trying to right itself. And that starts from all the work you did on your feet.
It's so exciting. I mean, I can't tell you all the things that I have tried. I mean, I think I went to about 1.5 years of continuous chiropractic work, just because of like all over pain and everything to try to get improvements. I started out going 3 times a week, then twice a week, then once a week I was still going like once or twice every other week. So I was doing that frequently for like 1.5 years and never got even remotely close to the results that I've had with block therapy. And this was like 26 days because I skipped 4 days. So this was like less than a month. And just to see the realignment and the amount of like decreased tension, decreased inflammation, and just feeling it too, like just not feeling as tense and tight, just feeling more relaxed, being able to move easier. Like it's amazing.
It's amazing. Let's go to your next amazing pictures.
All right.
Let's see what they are. Okay. Tell us some, you know what? This is within a minute of the previous picture.
Mhm.
All you did is raise your arms to the side, right?
Yeah.
The inflammation through your abdomen when your arm is not like in front of it, so we don't have that optical illusion of your arm breaking apart that width. The inflammation through your abdominal area is just crazy. It looks like you've lost 20 pounds
I
and
only lost 6 pounds in a
you
month.
lost 6 pounds.
Yeah. And I only lost, it was like right under my breast, I think I lost an inch. And I think my belly, I only lost an inch. So to me, it was like the visual results didn't quite seem to match up with the numbers. I was like, I do look like I've lost more weight in
Mm-hmm.
inches than I had. So exciting.
What else do you notice in this picture?
Again, I'm straighter. That head is not just like leaning as much. I'm more, straight up, looking forward. The decreased size in the belly, the pelvic tilt is improved so much. And I
Mm-hmm.
know that's just going to continue to get better, which excites me because that's been a huge problem as long as I can remember my whole life, just causing everything to be off and causing that back pain and all kinds of issues. And then the pelvic floor issues that I'm having. Also, I mean, I've had better results from the block therapy in a month than I did from doing the physical therapy for pelvic floor therapy for how long did I do that? Like 4 or 5 months continuously,
Yeah.
twice a week. Yeah.
And you're
So,
not doing, you didn't do any specific pelvic floor blocking, did you?
um, no, I did over the pubic bones a few times
From the
and
front. Yeah.
from the front. And then I think I did the perineum like once, which I was like,
And the
that was a lot, but
other thing to think about is when we say you had the block on the pubic bone twice, that's a total of 6 minutes
right.
over a 30-day period.
Mhm.
When you say that you did the perineum once, that's a total of 3 minutes
Yep.
because a blocking session, I would say, um, you stay for 3 minutes. You can stay for longer, but in a painful area, you don't usually want to hang out there. And so we're talking a very short
Yeah.
period of time on
That's why I look at my
either side.
results and it's just like it's amazing because some areas I didn't touch at all, like all those grips on the thighs, all those what
Mhm.
looks like cellulite or lipedema
Right,
nodule, structure of the
right.
skin. I
All this
didn't
right
I
here.
didn't touch that at all, not once.
And
And
look
so and
at
then when
that.
we yeah, and like the
Looks like
shoulder, going back to the shoulder alignment, like I only worked the armpit position again 3 minutes, like maybe twice in a
yeah,
month. So it's just astonishing. It's
yeah.
exciting.
Your back has to be feeling better too. I know you still have this line
100%.
here, but
Yes.
if you look how crunched your spine is here
Mm-hmm.
versus the lengthening here, because again, if you look where you can tell by where like your underwear falls, this is
Right.
lower. And so the lengthening here and the tilt down, it's helping your back not to be so crunched.
It is feeling better. 100%.
Okay, let's look at one more and then, well, that's the other side.
Okay. So this one, oh my goodness, the before my head is totally tilting to the side. Um, the
Oh, there's
shoulders,
something you want to point out on this one too.
the face.
Yes.
You pointed that out to me. I didn't even notice it. So yeah, if
Let's
you want to
zoom.
put your mouse up there and
Let's zoom
zoom.
a little bit.
So this would be my right side. So I told her like I've had jaw issues. I have sleep apnea. It kind of goes hand in hand with lipedema a lot. But I also clench and grind my teeth at night. And I've always had a lot of jaw tension. And I mean, I did Bowen therapy was another conservative therapy I did for like the pain and nervous system. And she does work on the jaw. And I remember just like, wow, it's so tense there. So I only did the block again 6 minutes max, like once or twice in that 30-day session. And she pointed out, look at the grips that you have right here. Like, look at that tension and that adhesion. And it's still there, but not nearly as much. Like
Not nearly as
or
much.
it improved significantly. And I was like, you're right, I didn't even notice that. So, and I think under the chin's a little bit less inflammation. I mean, I still have
It
a ways to
is.
go, but less inflammation there. But that grip on the cheek, and I can feel that, it's just like that Amanda looks uncomfortable and in pain. And she was like gripping and clenching and everything scrunched and tight. And it's just everything is coming into alignment and feeling better. And in areas that I didn't even think, I really needed to work on that much. So, and the jaw and the pelvis are related. So I guess I'm not
They are.
surprised seeing how the pelvis is coming into alignment. It's also helping the adhesions in the jaw.
Yeah. And
My, the
this
curve. Yeah.
curve is gentler.
Mm-hmm.
It's your shoulder isn't scrunched. It's just so many small things that add up.
Right.
I'm just so impressed with your progress.
I'm impressed too. I'm really excited. So this grip or adhesion on my upper right thigh is better, which I'm impressed about. Way before I had lipedema, back in like my early 20s, I had this dent there. I would just always call it my dent, my thigh dent. And I didn't know what it was. Like before I had any other like cellulite type of texture on the front of my thighs or anything, I had that dent there. And I was like, did I injure myself? I don't know what it was from, but you can see that it is definitely less deep. So if that could actually just go away after having it for decades and decades, that would be incredible.
The other thing I told you to look at on this picture was your butt.
You show it. You show it with your mouse because I didn't notice it at first, which made me really
All right.
excited.
So Amanda already talks about the way her butt is flat because she always, because of this tilt, because of her pelvic floor, there was a clenching. That actually makes your muscles flat and underdeveloped because you're clenching from the wrong place. It's not like a butt exercise. It's a totally different thing. And it's really common with lipedema, like these muscles in your legs and your butt. It's just like one big, long hunk of tissue. And it makes us look very wide. And if you look over here, she's getting some roundness back in those glutes. And there's actually, you have a tie in right here, the glute hamstring tie in. You're supposed to have a curve on your butt and then your leg attaches. And so instead of this flat part, she's getting a curve and she's also getting definition right here.
I see it.
And that is exciting.
It is exciting. It's like a Brazilian butt lift without having to do all the work, right? I one time did the block on the they call it for the hamstrings, where you actually have it up kind of high, sort of right under that butt cheek. And
Yeah.
I think I did it once. So we're talking 3 minutes that I had the block there within the 30-day time frame. And I'm like, oh, I'm getting curves in the right places. Like, yes, that flatness and that shape. I mean, yeah, my butt is wide, it's big, but it was never like round in the right spot. It was always flat there. And I think you're right. It had to do with like the clenching, the pelvic tilt. And to see that I have like a cute little like booty curve right there,
Woohoo!
that's a big win. So you pointed out that in the jaw, and I was like, I can't believe I didn't notice those things, but now I see them and they stand out. So
That's so exciting.
yeah.
All right. On the happy butt note, let's wrap up, and
Okay.
we have some more things to talk about part 3.
Yep. Part 3. Want to keep them short.
Yep.
All
We'll
right.
see you on part 3.
Thank you.